Hi everybody, this is Dr. Eliana Aaron, Director of EMA Care. It's May 19th, 2020, and I want to talk about some of the major changes that happened today, including the reopening of the Shuls scheduled for tomorrow morning. And I also want to talk about the dramatic change that happened last night. Also, they seem to send out notifications very late, but last night they sent out a notification, the new Minister of Health, that people did not need to wear masks when they were outside, and students do not have to wear masks. And this was going to go on through the heat wave we're currently in. And people are asking, why is that going on? So we're going to talk about those two things. Number one, when we talk about Shul's reopening, and we did talk about the risk factors of Shul's reopening, okay? So we talked in the previous video about the fact that being in a closed room, even with 2 meter separation between people, if you're there for a longer period of time, which we are when we are attending Shul, except for maybe Mincha, even if there's ventilation, there is a very high risk of transmission. And we've seen this in numerous outbreaks that go on around the world, that are going on and that have gone on around the world, where people were in a very large room. They were, 2 meters apart, and they were there for 2-3 hours, which 2 hours is, pretty much what you get when it's Shabbat. And what happens is that in some cases, 50% of the people, if one person was infected, 50% of the people ended up catching it, because the nature of the disease is that the more exposure you have at the higher viral count makes it much more likely that you are going to catch it. So that's why the synagogues ended up being the cause, let's say, the epicenter of the major outbreak we saw in specifically the Orthodox Jewish community internationally, right around Purim time, right after Purim. And almost all those cases were tied to people going to Shul, going to Megillah, going to Parshat Zachor, whatever it was, and ending up very much sick, and also spreading it to their immediate family members and other people in the community. So Shuls have unfortunately been a source of, in many cases, an incubator of this illness. Has the weather changed? Yes. Has the disease changed? No. Have the cases changed? In Israel, yes. In other communities, no. And we do know that the exponential impact this has had on the Orthodox and Haredi Jewish communities around the world has been very dramatic. I'm talking about 10 times the number of cases, and we talked about that in another video. 10 times the number of cases as a general population were affected in the Jewish community. So if 10 people out of 1,000 were infected in New York, then 100 people out of 1,000 were infected in the Orthodox community. And I'm just making those numbers up to explain, but the numbers were actually a lot higher. So that's part of the problem. So what do we do to make Shul safer? What are some of the issues that happen? So when Shul's open, first of all, I want to talk about the size of the room, because again, the more crowded the room, the more at risk it is. And you're allowed to have 50 people in any given space. Now, the people making these rules are not people who go to Shul necessarily, and they don't necessarily distinguish between a little shtibel where 10 people is already very crowded, and the great synagogue where 50 people is not crowded at all, and you could space very nicely. So that's part of the problem, is that there's a slippery slope involved, which is you open everything up, and then the safer spaces are mixed with the less safer spaces, and you can't say, well, that Shul can't open and that Shul can. So that's where we start getting into these problems. And I think 50 is a very nice number, but not every space is appropriate for 50 worshipers. And not 50 people should not necessarily be in a small space. I think good judgment is needed, and people have to be very careful about keeping the space and trying to keep Shul down to a tighter schedule. I know in some places the communities, when they were outdoor minyanim, the communities were saying, okay, daven until this point at home, and then we're going to do this part of the davening as a minyan. And that way you cut down the amount of time people were exposed to each other. Honestly, I was a lot less worried about outdoor minyanim than I was about indoor minyanim, because there have been very few cases of outbreaks going on from outdoor gatherings that have spaces between people. So I was less worried about that, but the shuls are very worrisome to me. And again, very little details. So I'm going to give you some details of what I think is appropriate in terms of hygiene and self-regulation, because they are relying on people to self-regulate. So first of all, when you're talking about the kalim, well, let's first talk about kissing the Sefer Torah. It's a bad idea. Don't kiss the Sefer Torah. Hashem will forgive us, okay? In Homs, Iran, there's a shrine. People kiss the shrine, okay? People were flooding to this shrine and kissing the shrine, and that became the epicenter of coronavirus. And it's just not a good idea. So anything that is touching our mouth, again, we're supposed to be wearing a mask in Shul, but anything that's touching our mouth is actually spreading droplets like manually. That's like the worst idea ever. The other thing is that the kalim that are shared, the kalim that are touched by multiple people, need to be taken care of and sanitized before and after people use them. So what does that mean exactly? The yad that is used needs to be sanitized. What does sanitize mean? An alcohol wipe, okay? Aron Kodesh, open and close. Everything has to be wiped before and after someone touches it. The Torah scrolls, the outer the Torah scrolls where you open and close the Sefer Torah for Ashkenaz, or the actual casement for a Sephardi Sefer Torah, those need to be sanitized before and after someone touches them, as well as all the accoutrements that are put on the Sefer Torah. Needless to say, when people are doing Netilat Yadayim for Kohanim or anything else, all of those areas that people touch has to be sanitized before and after use. Someone asked me about wearing gloves to shul. Wearing gloves, and I've said this multiple times, wearing gloves is not helpful if you don't know how to wear gloves. So medical people who are trained on wearing gloves, I know it sounds silly, we all know how to put on gloves, but the average lay person who doesn't understand the concepts involved in contact, cross-contact, contamination, their mind is not sort of programmed to understand that. So we look at gloves and say, oh, I'm safe now. But as soon as I touch my phone, as soon as I touch the mezuzah, as soon as I touch my face or my mask, as soon as I touch the armrest, okay, or the Aron Kodesh or anything else, I am now spreading those germs around, touching my eye, touching my eyeglasses. Eyeglasses are one of the more contaminated surfaces. And we've seen that in studies, and I discussed that also in some of our videos. So the mask is a false sense of security. And I think if people don't have a mask, sorry, not the mask, the gloves are a false sense of security, the mask we need. Because you think, I have a glove on, so I'm fine. But like I said, false sense of security. The glove ends up being contaminated. So not wearing gloves is okay. You need hand sanitizer. And once you use hand sanitizer, you know, okay, I just touched my face, hand sanitizer. When you have gloves on, you're like, oh, I touched my face, but I have gloves on, so I'm okay. It doesn't work that way. You can actually hand sanitize gloves, by the way. I do it all the time. So that's very important to also note. So I urge significant caution regarding that. Someone asked today, why did they all of a sudden stop telling people to wear masks this week? It's because of the heat wave. Statistically speaking, we have very few new cases in Israel. There are 2 new hotspots that cropped up. One of them is in Tel Aviv, and there's a neighborhood in Tel Aviv that is currently now in a closure because of that hotspot. But basically what we have is a situation where there's a very low risk of getting COVID right now, statistically speaking, in most areas. Okay, very few new cases. We don't know who those cases are. Very few cases, and we don't know who's going to be diagnosed tomorrow. We do know that in the extreme heat wave that we have now, there's a very good chance that people are going to get heat stroke or get severe dehydration and actually get sick from the heat. So the chances of overheating, and the mask does heat up your face, so the chances of overheating was higher, significantly higher than the chance of getting coronavirus. So it's a basically weighing what your risk is, and the risk for the next few days when it's over 100 degrees every single day, or over, let's say, 38 degrees, 39 degrees Celsius, is that because of Israel's situation, we can put the mask away when we are in public, when we are not in closed spaces, and when we're not near people. Again, you can't go near people. There are restrictions to this. It's not like everyone do what they want. But there is a rhyme and reason for this, and they're also concerned that if kids go to school and they wear a mask, they're not going to be drinking. And children, when they get dehydrated, can die. And we definitely don't want that, because they're not going to die of coronavirus. That's almost definitely true. So I think that that was probably the rationale behind it. It expires by the weekend when the heat wave disappears, and everything's going to go back to the way it was until further notice. So I wanted to just explain that, okay? Have a good day, everybody. Please take care of yourselves, and please use good judgment when going back to the synagogue.